The U.S. Department of Health and Human Services declaring a public health emergency in Los Angeles to address the health impacts of these wildfires. Here with us now to discuss this and other health headlines, physician and founder of CETA-Med, Dr. Lipi Roy. Doc, welcome back.
Thank you, Hena.
Let's talk about Los Angeles and these devastating fires. We know there's moderate to unhealthy air quality levels today. What should these residents know?
So it's absolutely horrifying what's happening in Los Angeles. HHS Secretary Becerra is actually working very closely. The federal agency is working very closely with state and local health agencies. And there's a group called the Administration for Strategic Preparedness and Response, which is an HHS agency which is working very closely monitoring hospitals and shelters, which are housing some of the most vulnerable individuals, and that are going to be overwhelmed in the coming days and weeks. So, look, urban wildfires are actually a little different from just regular wildfires, which burn shrubs and trees. Urban wildfires include houses, which have paint, rubber, metal, steel, and so those, when they burn, they release really toxic fumes and ash. So some of the short and long-term health effects from the smoke and the ash, small smoke particles that are less than 2.5 microns can really have significant health impact because they can go deep into the airways and lungs and then go beyond the lungs. So some of the acute symptoms include cough, wheezing, and severe respiratory distress. And some of the long-term effects, believe it or not, can include dementia and Alzheimer's, brain cancer, lung cancer. So people really need to be very, very careful. Go to see your doctor. The hospitals, which I know are getting overwhelmed. I also just want to reveal that the HHS also revealed a 24/7 disaster distress helpline. So I want people to call this if they need it. The number is 1-800-985-5990, and they are providing multilingual counseling for wildfire-related emotional distress as well.
Thank you so much for that, doctor. The fires are burning still today. What do California residents need to know?
Yeah, great question. So if you need to be outdoors, be sure to wear a mask, an N95 or a KN95. There's also P100. But if you can, try to avoid being outdoors. And when you're indoors, close your windows. If you're in the car, make sure your windows are closed, and make sure you're using recirculation of the air to minimize that outdoor air and smoke from getting inside.
Really good advice. I want to get your expertise on another virus that's making its way through China, HMPV virus. Should we be worried?
Yeah, so just so your viewers understand, so this is human metapneumovirus. It's a virus that's actually very similar to the flu. And by the way, unlike, say, SARS-CoV-2, which caused COVID-19, this is a virus that's been around since 2001, first identified in the Netherlands. It essentially causes symptoms that are almost identical to the flu. So upper respiratory symptoms, cough, wheezing, cough, nasal congestion, fever. So we don't have a treatment for it. There's no medications or vaccines. The main strategy really is prevention. So wear a mask, especially in crowded areas. If you're elderly, or it's the vulnerable are children under 2, the elderly, and people with weakened immune systems. So just try to avoid crowds and wear a mask if you need to be in crowded areas.
Let's turn to another virus. People around me have this, it seems like the stomach flu, some kind of stomach bug. It's going around. It's another virus. Yes. Tell us more about it, and how contagious is this?
Yeah, I think you're referring to good old-fashioned norovirus.
Yes.
So the winter season, Hena, is not just for respiratory viruses, but stomach viruses too.
Yeah.
So, you know, people call it the stomach flu, but to be very clear to your viewers, it is not influenza, it is norovirus, which is a highly contagious virus that's spread through contaminated food and water. Norovirus is actually the leading cause of vomiting and diarrhea and foodborne illnesses in the United States. So it basically unlike the respiratory viruses, it causes vomiting, diarrhea, and abdominal pain or stomach pain. Again, no medicines for that. Treatment is supportive, but really washing your hands and avoiding your best you can contaminated food. But it's really supportive care, fluids, rest. It can cause dehydration. So like if you're not urinating as much, dry mouth or throat, think about, you know, maybe norovirus. But really, it's prevention, washing your hands, and cleaning contaminated surfaces.
So anything else? Really is prevention, washing hands, making sure the area around you is sanitized.
Exactly.
All right. Hydration, I do want to ask about that. How important is it?
Yeah, because the main symptoms of norovirus are vomiting and diarrhea, it can lead to dehydration. And so what to look for there? Again, if you're not urinating very frequently, if you have a dry mouth, dry throat, these are symptoms for dehydration. So try to get as much fluids as you can. It is the way to really prevent and get better. And by the way, most people get better within 1 to 3 days from norovirus.
Doctor, is it too late to get the flu shot?
No, please get the flu shot. So that's the other thing. So even though we don't have a vaccine for norovirus, we have vaccines for influenza and for COVID-19. Get those vaccines and those boosters because it can at least prevent you from getting severely ill or hospitalized or even dying from these other respiratory viruses.
A lot of great information. A lot of people are sick these days,
I
Doc.
know.
Thank you so much. Dr. Lipi Roy, always a pleasure.